treat a real wide variety of patients, all the way from small infants up to very elderly people. I would say the majority of our patients are middle-aged people, people that have been very active in their lifetime and have suffered injuries over the years that have left them with some chronic conditions. And many of our new patients come to us because of injuries to their spine and are looking for alternatives to medical care, such as surgery or medications.
We try to find the best form of therapy based on the patient's conditions. We first of all want to get an accurate diagnosis. Then we can give the appropriate therapy. And here we found traditional chiropractic care is excellent, but we also have some conditions that don't respond to high velocity type manipulations, so we use flexion distraction type of techniques. We use adjusting instruments that will help us localize an area and give a comfortable, beneficial type of treatment. We use exercise as well as other forms of recommendations to help with the long-term management of their condition as well.
Well, we incorporate a very specialized form of spinal decompression called Cox Flexion Distraction. And we are certified in Cox Flexion Distraction Therapy. We find this to be very helpful for people that have very difficult conditions.
I suffered herniated disc in 3 discs, and I did not know that. I woke up one morning, I could not move, and it was an emergency, and I thought, you know, I had to see someone, not knowing what the situation. So I thought to call Dr. Greenwood. Lucky I got an appointment. I came here, found out I was in excruciating pain. Then he told me, actually, I was suffering from herniated discs, and not knowing anything about that, I was just in so much pain. And I was very lucky because I later found out he was one of very few doctors to have the Cox decompression table.
Conditions such as severe herniated disc, sciatic radiculopathy, spinal stenosis, or even young people that have scoliosis. It's a fairly gentle approach to manual therapy. It is very effective in the management of these very difficult conditions. We also use very standard chiropractic adjustments as well, but some people find that the more gentle, low-velocity approach used in Cox Flexion Distraction is more helpful. They tolerate it better, and they seem to enjoy it as they get improvement.
Since then, and I still come to see him for bi-weekly maintenance to really get myself strengthen up my back. And I've actually, right now, I'm in the healthiest state, as he has put it, than I have ever been.
As part of analyzing a patient's conditions, many times you're having to look at the entire skeleton. And in this case, we'll also look down at their feet. In case they have a foot pronation, we will be prescribing things like orthotic therapy to help with the proper alignment of their foot, which affects their back. We would also be looking at their posture. We would be looking at their nutrients as well, in case there are things that we can help them take to improve the strength of their bones, the repair of their cartilage and their joints that are injured, and for their general health as well.
Well, I'm motivated to come to work by the fact that patients get well. And I've done this for 3 decades now, and I'm always amazed to see the benefits that people derive from the treatments that we provide to them. And it's very gratifying for me to see people get benefit and to be able to help them in many ways, and then to help their children and family members that are referred to us.
You know, it's seeing people that have not gotten results elsewhere. And sometimes we're a last resort. We think of ourselves as a first resort, but many times it's the last. And when they come in and see us, and we are able to help them with chronic, difficult conditions, that lights up our hearts and our eyes for these types of patients. It's wonderful to see them get better. A wow moment for me would be when a young man named Rick Hansen came in to see me in 1985, who had hurt himself on a basketball court prior to him wheeling around the world. And if it wasn't for chiropractic care, I believe I was instrumental in helping him get better and feel better to go on his worldwide endeavor.